Good morning friends, I am Dr. Prathamesh Jain and I am going to discuss today about whether range of motion exercises can be started after a ACL reconstruction surgery. So friends, if you have a ACL surgery done, then can you start a range of motion or a knee bending exercise? So the best person to give this answer will be your operating surgeon, and I recommend all of you to be in touch with your operating surgeon regarding the post-operative rehabilitation and range of motion exercises of your knee. Now I'll just give you a brief general description. Now ACL reconstruction surgery can broadly be divided into two variants or two types. One is a solitary ACL reconstruction surgery in which there is no other repairs performed, and the second one is a ACL reconstruction surgery with meniscus repair or other ligament repair surgeries being performed. So those patients in which there are other meniscal repair or other ligament repair surgeries which are performed may need some kind of rest, some kind of immobilization and some kind of a restricted weight bearing. In this particular talk, we will be focusing on a solitary ACL reconstruction surgery without any meniscus or other ligament repair or reconstruction surgery. So if you are being operated for an ACL surgery, ACL reconstruction surgery, and rest of your knee is normal, your meniscus are normal, your other ligament are normal, your cartilage is normal, and no other surgery has been performed for that, then you can start a rapid, quick range of motion exercises. It has been proven in a number of studies that a quick rehabilitation, a fast rehabilitation, a quick range of motion exercises, which essentially means that you can bend and straighten your knee as soon as your pain is better after the surgery, leads to a good recovery and good result after the ACL reconstruction surgery. What you need to focus is to achieve a full extension of your knee as well as a full flexion of your knee, and if you are able to achieve a good extension and flexion, that means that if you are able to achieve a full, you are able to straighten your knee completely, and if you are able to bend the knee completely, then you will be able to achieve the best functional result after a ACL reconstruction surgery. Also, in the initial phases, specifically the initial 6 weeks, you should ideally focus on closed chain exercises in the range of motion fashion. So basically it essentially means that your distal part or your toe or your foot should be touching the ground, and closed chain exercises are recommended for initially 5 to 6 weeks. After 6 weeks you can start a slow open kinetic chain exercises as well. Also electronic stimulation exercises are very useful in rehabilitation and achieving the range of motion, because we have seen that many of the patients who have ACL tear will develop atrophy of the quadriceps muscles. So electric stimulation of the quadriceps muscles work well, and you should be in consult with your physiotherapy, start stimulation therapy, and that should be supplemented with voluntary contraction of your quadriceps and hamstring muscles, which gives the best results as far as the overcoming of your quadriceps atrophy is concerned. So friends, if you are having a solitary ACL reconstruction surgery, you can start a quick rehabilitation, you can start a range of motion exercise, specifically focusing on completely straightening the knee and completely bending the knee, specifically closed kinetic chain exercises in the initial half. Later on you can start with open kinetic chain exercises, and you can start voluntary contraction of quadriceps muscles, and electric stimulation will also be helpful in your case. Thank you.